Adam Schiff just torched Trump's EPA director, not with politics, but with facts. In one of the most brutal takedowns on environmental policy, Schiff lays out how gutting the EPA isn't just a bureaucratic decision, it's a death sentence for public health. He exposes how cuts to clean air and water programs translate directly into cancer rates, lead poisoning, and poisoned kids. This was more than a hearing. It was a moral reckoning.
Master Zeldin, you've only been at the EPA for a few months, but in that time, you've done more to dismantle this agency than probably all of your predecessors put together. That may be a source of pride for you, but it is not for the American people. You've unlawfully terminated grants without justification. You've fired and pushed out some of the best scientists who inform EPA's decision-making. You refuse to spend money that Congress has appropriated to the EPA by law. And you've launched a pro-polluter effort to delete dozens of environmental protections. On top of all this, you've launched an effort to overturn California's Clean Air Act waivers that improve the quality of air breathed by 40 million Californians and by millions more in other states who have adopted California's high standards. That effort, for which my colleagues have decided to eliminate the filibuster to achieve, is not exactly what anyone would call cooperative federalism. But it's your budget that's the ultimate proof of your priorities. You propose cutting America's environmental agency by 55%, meaning that in your view and that of President Trump, more than half of the environmental efforts of the EPA, more than half of the efforts to make sure Americans have clean air and clean water are just a waste. They're just a waste. Meaning that Californians and people all over the country, when they breathe the air, thanks to your good work, it'll mean there's more diesel and more other particulate matter in the air. When they drink a glass of water, they may not be able to see it, but this water that Americans drink is going to have more chemicals like PFAS, forever chemicals in their water. This will be your good work. I want to be very specific about the legacy you're going to leave if you're successful in eliminating half of our efforts to clean our water and our air. Your legacy will be more lung cancer. It'll be more bladder cancer. It'll be more head and neck cancer. It'll be more breast cancer. It'll be more leukemia and pancreatic cancer, more liver cancer, more skin cancer, more kidney cancer, more testicular cancer, more colorectal cancer, more rare cancers of innumerable varieties. That will be your legacy. I don't know that that's a legacy that anyone should want to have. My kids are going to be breathing that air just like yours. My family's going to be drinking the water just like yours. We may not be able to pinpoint just who gets cancer because you've done away with half the budget of those looking out for our clean water and clean air. But it's going to be somebody's kids. It's going to be somebody's family. To put this in more specific terms, there are 22 grants frozen by the EPA focused on improving health and reducing pollution, many of which directly impact children. For example, one project in Santa Ana, California, provided funding to help detect and prevent lead poisoning in children. According to the census, about 10% of the population in Santa Ana are under the age of 9. With a population of about 310,000 people, that means that 31,000 children are at risk of lead poisoning in Santa Ana without this funding. What is it about this grant that you and EPA believe is problematic enough to freeze this funding and put potentially 31,000 children at risk?
Senator, who is the grant applicant?
This is to the city of Santa Ana.
You have the biggest, state, so we're going to have to go through every single list of the grant. Well, by the way, with that wind-up, by the way, I understand that you were an aspiring fiction writer. I see why.
Oh, yeah. Well, I understand your view that you can cut half of the agency and it won't affect people's health or their water, their air. That, to me, is a big fiction, Mr. Zeldin.
You forgot about the fact of cleaning up
I have to
the
think,
LA
Mr. Zeldin,
wildfires.
I think, Mr. Zeldin, if your children were drinking water, if your children were drinking water in Santa Ana, Mr. Zeldin, maybe you wouldn't be so cavalier about whether there was lead in their water. Maybe you would give a damn instead of coming in here and suggesting that any grant that takes lead out of the water must be waste, fraud, or abuse because you need the money for a tax cut for rich people because you're totally beholden to the oil industry. You could give a rat's ass about how much cancer your agency causes.
The gentleman's time has expired. The chair recognizes herself.
What Adam Schiff did in that exchange was more than a political attack. It was a clinical translation of policy into human consequence. He stripped the abstractions of budget percentages and agency jargon and asked a single, simple question. If you cut half of the EPA's work, who pays the price? And the answer isn't an abstract ledger. It's kids with lead in their blood, families breathing diesel and particulate matter, communities drinking water with forever chemicals that don't go away. The EPA's job isn't paperwork. It's monitoring, enforcement, science, and intervention. Those 22 grants Schiff named aren't grant trophies on a shelf. They fund people who go door to door to find lead hazards. They fund clinics that screen children. They fund local air monitors that detect dangerous spikes and trigger responses. When you freeze that funding, you don't just delay a study or a report, you remove the early warning systems that stop harm before it becomes lifelong damage. Think about lead poisoning. It's not a theoretical risk. Elevated lead levels in a child's blood irreversibly reduce IQ, harm behavior and learning, and increase lifetime health and social costs. Programs that test water, replace lead pipes, and educate parents are the prevention side of the ledger. Let those programs go unfunded, and you shift the cost to emergency rooms, special education, lost productivity, and the sorrow of families who suddenly face a lifetime of consequences for something the government could have prevented. Or take PFAS, those forever chemicals. They're resilient in the environment and linked by peer-reviewed science to liver problems, certain cancers, and immune effects. Stopping the science, limiting monitoring, or shrinking enforcement capacity isn't a neutral act. It means fewer contaminated sites identified, fewer cleanups, and more communities left exposed. The economic argument you often hear, that regulation is costly, collapses when you consider the downstream price tag of illness, lost wages, and remediation. Investing in prevention is almost always cheaper than paying for the cure. Schiff's litany wasn't rhetorical excess, it was an effort to force an ethical accounting. Cuts framed as efficiency or reducing waste become, in practice, choices about which people are worth protecting. And because environmental harms fall disproportionately on low-income neighborhoods and communities of color, the policy becomes an engine of inequality. The people with the least political power breathe the worst air and drink the worst water. The nominee's answers, shrugging off specifics, refusing to commit to why a Santa Ana lead project was frozen, insisting agents can double duty their way out of resource shortages, reveal another problem: institutional indifference. You can have robust laws on the books, but without the staff to enforce them, the laws are dead letters. Monitoring networks go quiet, inspections are postponed, and the ability to respond to an outbreak or contamination event becomes reactive rather than preventive. There's also a civic dimension that Schiff tried to bring back into the room. Public health and environmental protection are public goods. You can't privatize clean air or privatize safe drinking water. The moment you treat them like optional line items, you turn collective necessity into a marketplace where only those who can pay get protection. That's not governance, it's abdication. Finally, the human image Schiff painted matters because facts alone don't move many people. Stories do. When he named cancers, lead poisoning in Santa Ana kids, and the tens of millions affected by rollbacks of California's clean air waivers, he translated policy into faces and futures. That's the test for any administrator. Can you look at a parent and say with a straight face that cutting the very programs that kept their child safe was worth it? This hearing should be a wake-up call. Cutting an agency's capacity by more than half isn't a budget choice in the abstract. It's a decision about what kinds of lives your government is willing to protect. If you care about healthy communities, about preventing disease before it starts, and about leaving your kids a world where clean air and water are the norm, not the exception, then this moment matters. If you want more explanations that connect policy to people, not just talking points, like, share, and subscribe to Left Lens. We'll keep pushing to show what these decisions mean in real life and who pays when power chooses priorities that put profit over public health.